Scientific Advisory Committee. So we have reached out. We are in discussions, but those discussions are not as mature as the partnerships that I announced today.
Okay, we can take a couple more questions.
Very quickly on the timeline. So the timelines that I mentioned of potentially getting the vaccines into clinical trials in the summer, Dr. Fauci from NIAID also mentioned that timeline with respect to the Moderna program. Those certainly depend on the development programs going well. I think they are our best estimate of how quickly we could feasibly get there if we don't encounter roadblocks. It will also be very important for our regulatory partners to work with us and to help us understand what exactly is required before we can move vaccines into clinical trials. The advantage of the platform technologies is that they have been in with the same platform, different vaccines, but the same platform have already been in humans, both for Moderna and for Inovio, one of our other partners. So we think that will expedite the ability to move these into clinical trials.
More questions? This lady on the right. Maybe we'll take both.
Yep. Okay. Yeah. So just first of all, how concerned are you with Chinese New Year on the way? What else, if you were advising China, what other precautions could they take? Obviously, we've got 2 more cases in Hong Kong as well. Hong Kong, has learned from SARS, but what else could China do? And lastly, why is this particular infection causing so much panic?
Maybe the next question.
And speaking to, so yesterday there were 448 cases, of which 102 were defined as severe or critical, which is actually about a quarter. So coming back to the how we cannot know what the case fatality rate is, which we know was 10% for SARS and up to 37% for MERS, but MERS was less widespread. But this could be actually, in what we're looking at, up to 25%. If we assume that, we know that people take a long time, days if not weeks, to actually die from a disease, and we're looking at the comorbidities that are existing: diabetes, hypertension, coronary artery disease, the usual suspects. In addition, the confluence of this is a pathogen which targets the lungs in a heavily polluted environment in the middle of winter with considerable other pathogens, and we wouldn't. I'm just trying to understand the dimension of the spectrum that we're looking at, and not wanting to downplay or over.
Yeah. So as Richard said, when you're in these circumstances and you do not have drugs specific and you do not have vaccines, you're reliant on classic public health measures, and what that means is hand washing and social distancing, and yes, restricting travel where it's at all appropriate, masks, and the earlier you do that within a city, the more chance you have for reducing. But what it does effectively is buy you some time to do the other things that are going on, including the vaccine development. Why panic? Well, the world has sort of been prepared, really sort of, if you like, sort of getting ready for something like this, really since SARS 18 years ago. And SARS left really deep scars on particularly the Asian and Toronto systems. And then, of course, we had the pandemic. So whenever you see an animal virus coming across humans, passing between humans and causing both mild and severe disease, of course the world is now really primed to know about that. And inevitably that causes a degree of panic. I don't think you can we don't want to overstate the panic here, because there is so much uncertainty. And we want to keep a sort of calm, moderated approach to it, but we do have to take this incredibly seriously, because you don't often get an animal virus coming to humans, passing between humans, and being spread by the respiratory route. It's what Richard and I and many others would have been frightened of for the last decade. The only thing I'd say on severity and case fatality rates, and this is just a general statement across all of these epidemics, going back to all of them, including Nipah, that I've been involved in since 1999, in the main, at the beginning of the epidemic, you see the more severe end of the spectrum. They're the people that seek hospital care, they're the people that seek intensive care, and that usually dominates your early. You can't tell for some weeks, actually, until you see the full spectrum of illness, quite how severe the spectrum is. And at the moment, we're in that period of uncertainty. Yes, 25% of the moment of the people may have had severe disease or be dying. We don't know what that really means in terms of the denominator in the population that has the infection, how many severe, and how many are dying. And we could all guess, but it would be a guess, as Richard said earlier. And we sort of have to live at the moment with that degree of uncertainty and not be intimidated by it.
We've run out of time. Uncertainty is the last word we heard. I would like to thank our 3 speakers and our experts for joining us today at the issue briefing room. Thank you very much for joining us today.
Thank you. Thank you.